طلاب المرحلة الثالثة السلام عليكم. موضوع محاضرة اليوم هو Narcotic or opioid analgesic and antagonists. The objectives of this lecture are to demonstrate opioid receptors, their classification, distribution, and effects following their activation. Narcotic analgesics or opioids, classification, pharmacologic actions, contraindications, main therapeutic uses, drug interactions, and adverse effects. And also, we will talk about individual narcotic analgesics. Opioids or narcotic analgesics. They are natural or synthetic compound that produce morphine-like effects. فبالنسبة للدراجز اللي هي ضمن مجموعة الأوبيويدز أو الناركوتيك أنالجيسيك، أما تكون natural أو synthetic compounds وكلها تشتغل they have morphine-like effects. Prototype of this group is the morphine, and كلمة morphine مشتقة من كلمة Morpheus, the god, Greek god of sleep and dreams. والopioids are related to opium. The opium is the dry juice of the seed head. Opioid receptors. There are three major receptor families. These are designated by the Greek letters mu, gamma and delta. فإذا عندنا three family receptors. الأوبيويد receptors هي الميو، gamma and delta opioid receptors. هذه الريسبتور تختلف من حيث اللوكيشن effects and الأجونست اللي تشتغل على هذه الريسبتورز. بالنسبة للميو receptors اللوكيشنز supraspinal and spinal. GABA receptors they are either distributed spinally or supraspinally، والدلتا receptors تكون موجودة at spinal and supraspinal locations. Effects on these receptors. بالنسبة للstimulation of mu receptors راح ينطينا analgesic effect. Also will cause respiratory depression, sedation, euphoria, meiosis or constriction of the pupil, bradycardia, hypothermia, or physical dependence. Effects of GABA receptors stimulation will produce spinal analgesia, dysphoria, sedation and psychomimetic effects. وبالنسبة للدلتا receptors stimulation will result in spinal analgesia, affective behavior and respiratory depression. الأجونستس اللي تشتغل على هذه ال 3 different types of opioid receptors. بالنسبة للميو receptors الأجونست راح تتضمن المورفين، كودايين، فنتانيل، بنتازوسين and endorphins. Whereas الأجونست for the GABA receptors include pentazocine and dynorphins, while agonist for the delta receptors include enkephalines. فإذا شفنا الأوبيويد receptors تختلف من حيث their locations أو distribution بالCNS، و they will the effect of stimulation of these different types of receptor will be different. And also the agonist which will act on each type of receptor will be different. All the three opioid receptors are G-protein coupled receptors, and the mechanism of action of stimulation of opioid receptor, they inhibit adenylyl cyclase activity, resulting in a reduction in the intracellular level of cyclic AMP. إذن بالخطوة الأولى they cause inhibition of adenylyl cyclase activity and a reduction in the intracellular cyclic AMP level. These drugs, narcotic analgesic, they cause increased postsynaptic potassium efflux, and this results in hyperpolarization, and also they produce reduction in presynaptic calcium ion influx. فإذا they cause increase in potassium ion efflux postsynaptically and reduction in calcium ion influx presynaptically. Therefore, they cause inhibition of neuronal firing and neurotransmitter release such as glutamate. فإذا السمري of mechanism of action of this group of drug, they cause the carnet سوينا inhibition adenylate cyclase activity and a reduction in the intracellular cyclic AMP level. They cause increase in postsynaptic potassium ion efflux, and this effect will produce hyperpolarization and a reduction in presynaptic calcium ion influx. Therefore, they cause inhibition of neuronal firing and neurotransmitter release such as glutamate. Pharmacologic actions. The main pharmacologic actions, they produce analgesia or relief of pain. Second, they produce euphoria. Euphoria معناها شنو? A powerful sense of well-being. Their effect on respiration, they cause respiratory depression, and this effect is induced or produced by a reduction of the sensitivity of the respiratory center neurons to carbon dioxide. إذن هذه الدراجز تأثير على respiration, they cause respiratory depression, and this effect is produced by a reduction in sensitivity of the respiratory center neurons to carbon dioxide. Respiratory depression is the most common cause of death in acute opioid overdose. فإذا السبب الرئيسي للdeath بحالة acute opioid overdose أو opioid intoxication راح يكون هو respiratory depression. Other effects of these drugs include depression of cough reflex. Depression of cough reflex أو they cause cough suppression. ولذلك راح نشوف قسم من هذه الدراجز ممكن نستخدمها كأنتيتوسيف to suppress cough. They produce meiosis on the eye. They produce meiosis or pinpoint pupil. This is a characteristic effect of morphine overdose. يعني هذا الشيء كلش مهم. They produce pinpoint pupil. This is important diagnostic feature of a patient with morphine overdose. لأنه نشوف أكو هواية عندنا مرضى أو patients they pass into coma and respiratory depression, but they are presented with dilated pupil. For example, in case of meperidine poisoning, which is a narcotic or opioid analgesic, it is used to relieve moderate to severe pain. A drug overdose of this drug يعني إذا البيشنت كان عنده toxicity of meperidine, the patient will be presented with dilatation of pupil or mydriasis. بينما البيشنت اللي عنده morphine overdose will be presented with pinpoint pupil, meiosis or pinpoint pupil. فهذه حتكون diagnostic feature. They produce emesis. These drugs stimulate the chemoreceptor trigger zone that cause vomiting. Then they produce emesis, وهذا الإفكت منين راح ينتج عن stimulation of the chemoreceptor trigger zone, which is responsible for initiating the vomiting reflex. On the gastrointestinal tract, these drugs relieve diarrhea by decreasing motility and increasing tone of the intestinal smooth muscle, leading to constipation. إذا تأثير هذه المجموعة من الدراجز أو الأدوية على gastrointestinal tract, they can be used to relieve diarrhea. And this effect is produced by a decrease or reduction in the GIT motility with increased tone of the intestinal smooth muscle. تقلل الموtility وزيادة tone of the intestinal smooth muscle, and these effects will result in constipation. بالنسبة للeffects of opioid analgesic on the genitourinary system, they inhibit micturition or bladder emptying reflex, resulting in retention of urine, and they have anticholinergic-like effect. Thus, catheterization may be required. بالنسبة لتأثيرها على urinary system, opioid analgesic or narcotic analgesic, they inhibit bladder emptying reflex, and they result or they produce retention of urine, anticholinergic-like action, and therefore catheterization. The patient may need a catheter to evacuate the bladder. ممكن أن نستخدم الكاثيتر to empty the bladder. The effect of narcotic analgesic on the cardiovascular system. At large doses, they may produce hypotension and bradycardia. إذن الهاي doses of narcotic analgesic راح ينتج عنها hypotension وبراديكارديا. And this effect results from the respiratory depression and carbon dioxide retention. فإذا carbon dioxide retention, cerebral vessel will be dilated with increased intracranial pressure. فإذا مثلا البيشنت إذا كان عنده مثلا مورفين overdose راح نشوف يصير عنده hypotension وبراديكارديا. ومنين تنتج هذه الهايبوتنشن وبراديكارديا؟ These effects usually is caused by respiratory depression, carbon dioxide retention, and this effect will result in dilation of cerebral vessel with increased intracranial pressure. Therefore, morphine is usually contraindicated in individuals with severe head injury. يعني هذه من ضمن important contraindications of this group of drug with severe head injury. وممكن نستخدم هذه group of drug narcotic analgesic لمريض يعاني من severe head injury. زين، لأنه هي ممكن تسبب لنا قلنا at large doses they may cause hypotension or bradycardia and respiratory depression. Therefore, they are contraindicated in patients with severe head injury. بالنسبة للإفكت of narcotic analgesic on histamine release, morphine releases histamine from mast cells, causing urticaria, sweating, vasodilation. Asthmatics or asthmatic patients should not receive the drug. فإذا بالنسبة لتأثير narcotic analgesic on the release of histamine, they induce or increase the release of histamine from mast cells. Therefore, they may cause symptoms of urticaria, sweating, and vasodilation. فإذا كان البيشنت asthmatic, better not to use أو يعني they are contraindicated in asthmatic patient. فإذا ممكن نستخدم narcotic analgesic in asthmatic patients. The hormonal actions of the narcotic analgesic. Morphine inhibit release of gonadotropin releasing hormone أو GRH hormone, and also corticotropin releasing hormone أو CRH. فإذا المورفين راح يسبب inhibition أو reduction بالرelease of GRH و CRH hormones, and it decreases the concentration of FSH, LH, ACTH, and beta endorphin, testosterone, and cortisol. فإذا تأثير الناركوتيك analgesic على الهرمونز قلنا المورفين will cause inhibition to the release of gonadotropin releasing hormone, corticotropin releasing hormone. تسوينا inhibition, where it also causes a reduction or decrease in the release of FSH, LH, ACTH, beta endorphin, testosterone, and cortisol. Morphine increases growth hormone release and enhances prolactin secretion. It increases antidiuretic hormone release. فإذا the other hormonal effect of narcotic analgesic, they cause increase in the release of growth hormone and prolactin, and also they cause increase بالantidiuretic hormone secretion. فإذا الهرمونal effect of narcotic analgesic أو نحكي عنها specifically مثل المورفين, ممكن تسبب لنا inhibition the release of some hormones و increase the release of other hormones. فإذا قلنا هي تسبب لنا inhibition the release of gonadotropin releasing hormone, corticotropin releasing hormone, decrease in the release of FSH, LH, ACTH, beta endorphin, testosterone, and cortisol, whereas they induce increase in the release of growth hormone, prolactin, and antidiuretic hormone. Effect of narcotic analgesic on labor. Morphine may prolong labor by transiently decreasing the strength, duration and the frequency of uterine contractions. إذن المورفين ممكن نستخدمه واحدة من الاستخدامات المهمة بالليبر because they may cause a prolongation of labor because they cause a transient decrease in the strength, duration and frequency of uterine contractions. Therapeutic uses of narcotic analgesics. First, in case of analgesia, morphine, tramadol, fentanyl and methadone can be used to induce analgesic effects. فإذا ممكن نستخدم narcotic analgesic to produce analgesic effect. They are used in the treatment of diarrhea. Example, diphenoksidate and loperamide. They are used for the relief of cough. من ضمن الناركوتيك analgesics اللي ممكن نستخدمها for the relief of cough codeine, dextromethorphan and noscapine. They are used in the treatment of acute pulmonary edema. Intravenous morphine dramatically relieves dyspnea caused by pulmonary edema, which is associated with left ventricular failure, and this is because of its vasodilatory effect. فإذا morphine is indicated, is used, ممكن نستخدم بحالة treatment of acute pulmonary edema, which is associated with acute left ventricular failure. They are used in case of anesthesia. ممكن نستخدم قسم للناركوتيك analgesic مثل الفنتانيل نستخدمه anesthetic agent. Also, they are used or indicated in case of opioid dependence, such as methadone and buprenorphine. This table shows the effect of narcotic analgesic, different effects of مثل ما ذكرنا قلنا they produce analgesic action, and also they have some of these narcotic analgesic has antitussive effect. They may cause they have an effect on the GIT smooth muscle. Again, they cause spastic or contraction of smooth muscle of the GIT, and also they cause constipation, and also they can be used as وبالنتيجة ممكن نستخدمها كأنتي diarrheal drugs. والإفكت على urinary bladder they cause urinary retention. Classification of the narcotic analgesic according to their strength of effect. وممكن نصنفها حسب strength of effect of these drugs. أما تكون strong, example عندنا المورفين, methadone, meperidine, pethidine, tramadol, heroin and oxycodone. المودراتely acting narcotic analgesic أو المودرات عندنا الكودايين, والويك عندنا propoxyphene. فإذا أما تكون strong, moderate أو weak action. وعندنا الميكست agonist antagonist أو partial agonist, example buprenorphine, pentazocine and nalbuphine. والانتاغونست عندنا example عليها naloxone and naltrexone. Pharmacokinetics. The opioids are well absorbed orally and they undergo first pass metabolism. فإذا ممكن نستخدمها كoral preparation where they تكون well absorbed and they undergo first pass metabolism in the liver. They cause the placental barrier and therefore they affect the fetus and they may produce respiratory depression and physical dependence in the neonates. فإذا they can cause تعبر البلاسنتال barrier وممكن تأثر على الفيتس وتسبب لنا respiratory depression and even they cause physical dependence in the neonates. Metabolism of these drugs, usually they undergo metabolism in the liver by the hepatic enzymes, and their elimination is usually by the kidneys. The duration of action of morphine is 4 to 6 hours. Most opioid analgesics are well absorbed when given by subcutaneous, intramuscular and oral routes. فإذا ممكن نستخدم different route of administration. ممكن ننطي الأوبيويد analgesic أما orally أو intramuscularly ويكون الابزوربشن مالته they are undergo يعني they are well absorbed when they are given by these different route of administration. other routes of opioid administration وعندنا طرق أخرى لإعطائها. ممكن نعطيها by the lozenges يعني راح يكون absorption by the oral mucosa، أو عندنا transdermal route via patches، and also الباتشز ممكن تنطينا long duration of effect، يعني ممكن الأكشن ما راح يكون over days. فإذا عندنا different route of administration of the opioid or narcotic analgesic. ذكرنا ممكن ننطيها orally, subcutaneously, intramuscularly، أو ممكن ننطيها by the lozenges. الابزوربشن حيكون ذكرنا through the oral mucosa أو the transdermal patch، والduration of effect راح يكون will be long over days. Adverse effects of narcotic analgesics: they may produce respiratory depression, vomiting, constipation, euphoria, allergic reactions, hypotension, hypotensive effects or hypotension, urinary retention, tolerance and dependence. فإذا الأوبيويد analgesic تسبب many adverse effects، ومن ضمنها قلنا respiratory depression, vomiting, constipation, euphoria, hypotension, urinary retention, and also they may induce tolerance and dependence. Drug interactions: seriously ill or hospitalized patient may require a large number of drugs. طبعا البيشنت اللي حيكون يعني بالنسبة للinpatients they may require a large number of drugs, and therefore there is a possibility of drug interactions when opioid analgesics are administered. This table shows drug interactions or drug interacting with the opioid analgesics. For example, sedative hypnotics, they may cause increased CNS depression and respiratory depression. فإذا الانتراكشن between narcotic analgesic and sedative hypnotic, they will produce effect of CNS depression and respiratory depression. For the antipsychotic agent, they cause increased sedation. Sedative effect راح يكون will be increased. الزايدة sedative action of the antipsychotic agent. Where also they may cause, they will affect, they have an effect on respiration. They may cause respiratory depression. وبالنسبة للمونوأمين oxidase inhibitor, there is a relative contraindication to all opioid analgesic when the patient يحتاج إذا كان patient يحتاج إلى monoamine oxidase inhibitor, because there is a high incidence of hyperpyrexic coma and even hypertension. فإذا إذا كان patient يستعمل المونوامين oxidase inhibitor, better to not to use من الأفضل عدم استخدام الأوبيويد analgesic، لأنه ممكن تؤدينا إلى حالة الهايبربايركسيك كوما وهايبرتنشن سبب زيادة بضغط الدم. How to avoid and treat withdrawal symptoms. الأوبيويد drugs أو narcotic analgesic should not be stopped suddenly. They should be stopped gradually. And also physical and emotional support and supervision. يعني patient اللي يستخدم opioid أو narcotic analgesic يحتاج إلى physical emotional support and supervision. وبالنسبة للميديكيشن بحالة withdrawal symptom نحتاج إلى other medications such as anticonvulsants, antidepressants and symptom specific pharmaceuticals which control the more difficult withdrawal symptoms. فإذا البيشنت اللي بحالة الwithdrawal symptoms ممكن نستخدم other medications مثل anticonvulsants, antidepressants. Slow tapering the dosage, and this will keep the opioid receptors filled and will prevent the onset of severe withdrawal symptoms. فإذا عندنا نقطة مهمة بحالة withdrawal symptoms بحالة narcotic analgesic, we should have a slow tapering of the dosage, and this will keep the opioid receptors filled and it will prevent the severe withdrawal symptoms. And also we should have a replacement of the short-acting opioids like heroin with a longer-acting opioids such as methadone. فإذا هذه النقطة جدا مهمة، لازم نسوي replacement، يعني نبدل الشورت acting opioid مثل الهيروين نبدلها ب longer acting narcotic analgesic مثل الميثادون. This table shows the common opioid analgesics and their effect on the different opioid receptors. والeffect راح يكون يختلف، أما تكون they will give a strong agonist effect, partial agonist effect, أو weak agonist effect and antagonist effect. راح نشوف ال different opioid analgesic تشتغل على ال different types of opioid receptor ب different effects. an example على الopioid analgesic عندنا piperidine أو betadine. It is an analgesic agent and it has mild effect on the uterine smooth muscle, thus it is commonly employed in obstetrics. فممكن نستخدمها بحالة الاستخدامات النسائية لأنه عندها mild effect on the uterine smooth muscle. Where it is not clinically useful in the treatment of diarrhea or cough. فالميبريدين والبيتيدين استخدامها راح يكون قليل بحالة treatment of diarrhea or cough, where it is commonly employed in obstetrics. Methadone, it is a synthetic orally effective opioid that is approximately equal in potency to morphine. فإذا الافيكاسي أو البوتنسي of methadone راح تكون تقريبا مثل اللي يشتغل نفس البوتنسي of morphine, but it induces less euphoria and has a longer duration of action and a cardiotoxic effect. فإذا تقريبا راح يشتغل نفس فترة عمل المورفين، لكن الفرق اللي راح يكون بينه وبين المورفين الميثادون it has a longer duration of action and it has less cardiotoxic effect. Therapeutic uses of this drug, it is indicated as an analgesic agent and it is used in the treatment of withdrawal symptoms, which is caused by heroin and morphine. Moderate agonists include codeine. Codeine, much less potent and analgesic than morphine. فإذا الكوداين البوتنسي راح تكون أقل من المورفين. Codeine shows good antitussive activity, rarely produces dependence and produces less euphoria than morphine. فإذا إذا سوينا مقارنة بين الكوداين والمورفين هيكون الكوداين less potent than in analgesic activity than morphine. Where codeine it shows a good antitussive activity, ممكن نستخدمه بحالات to suppress cough, where it rarely produces dependence and produces less euphoria than morphine. Propoxyphene, it is used as analgesic to relieve mild to moderate pain. فإذا propoxyphene ممكن استخدامه بحالة ال relief of pain نستخدمه كأنالجيسيك of mild to moderate pain. Tramadol and pethidine inhibit the uptake of serotonin and norepinephrine, thereby increases their levels within the CNS. إذن الترامادول والبethidine تسوي لنا inhibition of serotonin and norepinephrine أو noradrenaline uptake, where therefore they increase the level of both of these serotonin and norepinephrine within the CNS. As the norepinephrine level rise, sympathetic system is activated. فإذا ال increase the level of norepinephrine will cause activation of the sympathetic system. Mixed agonist and antagonist and partial agonist. Drugs that stimulate one receptor but block another are termed as mixed agonist antagonist. فإذا عندنا group of drugs اللي هي تكون agonist and antagonist. These drugs, they act on one type of receptor, causing activation or stimulation of this specific type, but they cause a blockage of the other type of receptors. Therefore, they are called or termed as agonist-antagonist drugs. The effects of these drugs depend on previous exposure to opioid. يعني يعتمد تأثير هذه المجموعة من الأدوية على التعرض السابق لمجموعة الناركوتيك أو الأوبيويد analgesic. In individuals who have not recently received opioid naive patients, mixed agonist-antagonists show agonist activity and are used to relieve pain. فإذا إذا كان البيشنت ما متعرض بشكل سابق أو ما ماخذ جرعة سابقا من الأوبيويد analgesic نسميه naive patient. هذه الدراكس راح تشتغل كأجونست أنتاجونست. They will show agonist activity. هذه مجموعة agonist antagonist they will show agonist activity and they can be used to relieve pain. لكن إذا كان patient with opioid dependence, the agonist antagonist drug may show blocking effect and they can produce withdrawal symptoms. فإذا إذا كان المريض متعرض بشكل سابق أو ماخذ جرعة سابقة من الأوبيويد أو narcotic analgesic, the agonist antagonist drugs will act as antagonists or they show blocking effects and they may produce withdrawal symptoms. فإذا ممكن تشتغل كأجونست أو antagonist تعتمد على تعرض المريض إلى جرعة سابقة من هذه الدراجز. Buprenorphine, it is a partial agonist drug. It acts like morphine in naive patient, but it can also precipitate withdrawal in morphine users. فإذا هو partial agonist والبيشنت وممكن يشتغل كمورفين in naive patient ما ماخذ أو ما متعرض لجرعة سابقة من المورفين أو الناركوتيك analgesic. It acts like morphine. But it can precipitate withdrawal symptom in morphine users. إذا كان المريض يعني عنده previous exposure للمورفين, it can precipitate withdrawal symptoms. It is used in opioid addiction because it has a less severe and shorter duration of withdrawal symptoms than other opioids. فإذا it can be used بالopioid addiction, ممكن نستخدمه, but it has less severe and a shorter duration of withdrawal symptom than other opioid. يعني withdrawal symptom حتكون shorter and less severe in condition of buprenorphine drug. The injectable form is indicated for the relief of moderate to severe pain. It can be given by injection, where drugs which is given buprenorphine when it is given by injection, it can be used to relieve moderate to severe pain. ممكن نستخدمه في حالات moderate to severe pain. Pentazocine, it is similar to buprenorphine. Pentazocine راح يكون it mimic like it act like يشبه البنتازوسين البابرينورفين. الانتاغونست عندنا demonstration of opioid antagonist produce no profound effect in normal individual, but in patients dependent on opioid, يعني patient who show opioid dependency, antagonists rapidly reverse the effect of agonist and such as heroin. يعني إذا كان patient normal ما عنده أي previous exposure للopioid analgesic, they show no effect, they produce no effect. But in patients with who are dependent on opioids or narcotic analgesic, they can rapidly reverse the effect of the opioids or narcotic analgesic, such as heroin. Then, naloxone, it can be used as antidote in case of narcotic بالopioid poisoning ممكن نستخدمه كأنتيدوت. Naloxone is used to reverse the coma and respiratory depression which is caused by opioid poisoning. فالأنتيدوت بحالة الopioid poisoning أو الoverdose of opioid analgesic ممكن نستخدم النالوكزون كأنتيدوت. It can reverse the symptom of coma and respiratory depression. Naltrexone is similar to naloxone, but it has a longer duration of action than naloxone. It is used in the treatment of alcohol and opioid addiction. عندنا another drug اللي هو naltrexone. It acts like naloxone, but it has a longer duration of action, and it can be used in the treatment of alcohol and opioid addiction. ممكن يستخدم بحالة الالكحول والopioid addiction. Endogenous opioids example عليها عندنا الداينورفينز, انكيفالينز, endorphins, endomorphins and nociceptine. They are responsible for the feeling of happiness and ability to withstand stress. فعندنا مجموعة من الأوبيويد تكون endogenously released نسميها endogenous opioid. These group of drugs are responsible, drugs or chemicals responsible for the feeling of happiness and the ability to withstand stress. وعندنا example عليها مثل ما ذكرنا عندنا داينورفين, انكيفالين, اندورفين and endomorphins. بالنسبة للcontraindication to the narcotic analgesic أو الopioids عندنا many contraindications for this group of drugs. They are contraindicated in patients with severe respiratory depression and in asthmatic patient مثل ما ذكرنا because they induce respiratory depression. فإذا it is indicated in case of severe respiratory depression and also contraindicated in asthmatic patient. Acute psychiatric instability and uncontrolled suicidal risk. فإذا كان patient عنده history of psychiatric instability أو psychiatric disorder أو عنده attempt of suicide, these drugs are contraindicated in these patients. In case of head injury, narcotic analgesic are contraindicated in case of head injury. Hypersensitivity to opioid. Then they are also contraindicated when there is hypersensitivity or allergy to the opioid or narcotic analgesics. Intoxication with alcohol or sedatives. In case of إذا كان عندنا intoxication or overdose of sedatives or alcohol, they are contraindicated in this condition. Gastrointestinal disorders, paralytic ileus, inflammatory bowel disease. Narcotic analgesic or the opioids are contraindicated when in some gastrointestinal disorders such as in case of paralytic ileus or in case of inflammatory bowel disease. They should be used cautiously during pregnancy because they may prolong labor and may predispose or they may produce fetal dependence. إذن بالنسبة لpregnant females, the use of narcotic analgesic or opioid, they can be used with caution and under medical supervision because they may cause prolongation of labor and also they may predispose to fetal dependence, fetal distress and fetal dependence. لأنه مثل ما ذكرنا ممكن تعبر للبلاسنتال بارير وتأثر على الفيتس. They should be used cautiously in shock state, particularly in the elderly. إذا كان patient in shock state, narcotic analgesic أو opioids, they should be used cautiously, especially إذا كان patient, elderly patient. وعندنا they should be used cautiously also in patients with prostatic hypertrophy or urethral stricture. فإذا they should be used cautiously in patients who have prostatic hypertrophy or in case of urethral stricture. فإذا عندنا major contraindications for the use of the narcotic analgesic أو opioids تشمل عندنا severe respiratory depression and asthma. حالة respiratory depression with patients with asthma. They are contraindicated in psychiatric disorder and إذا عندنا history of suicidal attempt أو suicidal risk. in patient with head injury, they are also contraindicated in case of hypersensitivity to the opioid or opioid allergy. They should not be used in this condition. Intoxication with alcohol or sedatives. إذا كان عندنا patient who take high dose of alcohol or sedatives, أو in case of overdose أو intoxication with these medication sedatives أو alcohol intoxication, they are contraindicated in this condition. In case of gastrointestinal disorders such as paralytic ileus and inflammatory bowel disease, they are contraindicated in this condition. وعندنا they should be used cautiously during a pregnancy because they may cause prolongation of labor, and they can pass the placental barrier, and they may predispose to fetal distress and fetal dependence. وعندنا also they can be used with caution in patients with shock state, especially in elderly patients, where they can be used cautiously in patients with prostatic hypertrophy or in patients with urethral stricture. This is the end of our lecture, and thank you for listening.